Now this is for couples. Couples gather. You see, the mistakes that some people make is when they get a sexually transmitted disease, they hide, right? My husband shouldn't know, my wife shouldn't know. So you hide, big man, big woman, you hide yourself. You come to the clinics and actually pick medication for yourself, leaving your two women behind, right? So because you have a urethral discharge, or the head of your penis is swollen, or you're having some itching, lymph nodes are swollen down there, you decide to secretly seek medical care alone, and then you go back home. Remember, your partners are acting like reservoirs for the infection. And so for you, seeking treatment for yourself, hiding, thinking you're doing the right thing, all your efforts are going to go to waste until you bring all your sexual partners, all the people that you are involved with sexually, to be checked and treated as well. And so for sexually transmitted diseases, please don't hide. There's no need to hide. I know there's a lot of shame and stigma and finger pointing when it comes to STDs, but hiding should not be one of the things that you do. When you have the symptoms, ensure that you openly talk to your sexual partners, and also have someone that you can openly discuss with. Have someone that is understanding. When you end up with an STD, communicate. Babe, I'm having this and this, and I feel like I need help. And so come to the hospital as a couple, check and get treated promptly, all of you. And while you're treating an STD, avoid sexual intercourse during that time. Or if you intend to do it, use a condom, such that you don't pass on the disease to your partner. Again, all of this is rooted in you not trying to waste resources. First, your time and the money. In these treatments are not cheap. So are the tests. Nothing is cheap. So to make sure that you're benefiting from your investment, bring all your sexual partners, all of them. 5, 4, 3, 2, 1. Bring them. Let them be screened and test and are treated if they are found to have the disease as well, such that your efforts are good. You get results from your effort. Otherwise, you are doing nothing. So stop hiding. By hiding, you're only making things worse. And I encourage couples to openly discuss. Sexual and reproductive health things shouldn't be things that you hide. There should be open communication with your partner. How are you feeling emotionally? If you're disconnected, tell your partner, I don't feel like this. I don't feel like we should be together. I'm going through things, But some of you go into it even if your mind is not into having intercourse, and then your partner feels like they have had the worst experience, and this goes on, and they end up going out there to source for what they can't have. So you know that sex is a mental issue. Have it when you want it, when you need to, when you both feel like it, and communicate. There's nothing in this world that can't be discussed. Communicate openly with your partner, and always be on the same page. Your partner should be your friend, and your friend should be someone that you fear and hide things from. I hope that this message reaches home. I hope that it finds the intended audience. I don't want people to be wasting time and resources. Treating yourself and not treating your sexual partners is such a gamble and a waste of resources. Okay? Twedeko bannange twekuume. Use condoms. Always ensure that you check the expiry date. Again, 1 condom, 1 round. Don't wear 9 condoms at once. Don't wear more than 1 condom. Don't put on the condom too early or too late. Ensure that you don't use your teeth to bite or razor blades to cut it open. You're going to damage the condom. Ensure that you use condoms appropriately. Check the expiry date. Check that it's the size which fits. Only put on an engorged penis. And stop using oil-based lubricants. If you need to use a lubricant, use a silicone or water-based lubricant which are condom safe. Oil-based are going to break down the rubber, and then the condom will break. I'll talk about condom breakage next time. But for now, STDs, let's screen. They are treatable. These are things that can be treated, and if you don't treat them, especially for our ladies, they can block your fallopian tubes and you end up with infertility because of long-standing sexually transmitted infections. So you don't want that. Ensure that you get checked. Open communication with your partner. No pointing fingers. Just owning what's happening and getting treated is the right way to go. Thank you so much for listening, and subscribe to Dr. Mtunga TV on YouTube. We are growing thanks to you, and I will catch you next time. Thank you.